want to check, yeah.
Can I just ask, perfect, if you can just mute yourselves. Good afternoon, everyone, welcome. Thank you for joining me for today's Menopause Cafe. It's going to be very relaxed, supportive space to just learn, ask your questions, share if you like to, and of course, the focus of this month, as you know, is World Menopause day and month, but also it's October is Breast Cancer Awareness Month. So it's really good that we have both of these very important topics all in October, but we'll be focusing on breast health during and after the menopause. So we've sort of combined them a little bit with a focus on breast, but during the period of menopause. Of course, a topic that is very important and matters to all of us. So many breast changes happen during and around menopause. That's before breast starts to change during this time. And most are completely benign. It's really good to know that, to rest assured that, you know, the majority of these changes are completely benign, but being breast aware helps notice what's normal for us, what's not normal, when to get help, and when to get checked. So awareness doesn't mean that we need to have anxiety about it, but it sort of gives us, the awareness should give us the confidence to know how often we should be checking, what we should be looking for, and when to sort of seek help and go for investigations. Now, looking at the two major female hormones, estrogen and progesterone, and what happens with their decline. Estrogen and progesterone keep the breast tissue glandular and firm. And of course, at perimenopause and menopause, especially, these hormones drop, and breast becomes less dense and more fatty, just generally. I'll look at that in more detail in the next slide. But that this sort of is the underlying physiological change that happens that gives us, you know, that the breast to feel very different. They often are softer, they're smaller, sometimes they become saggy at menopause. But looking at the actual tissue and the what happens is that, generally speaking, this sort of diagram that you can see, it shows how tissue composition changes, the breast tissue composition. And the important thing is that these are absolutely normal, natural changes. So, oops, sorry, let's go back to that. So this is the, you know, very young breast that is almost entirely glandular. So it's quite dense, it feels quite firm. And then with time, and as we go through the later stages of perimenopause and menopause, it actually becomes almost entirely fatty. But it also explains why we can start feeling lumps and bumps much more at the time of perimenopause. There's various reasons for this. One, of course, is the huge fluctuations in the hormone levels, estrogen and progesterone. Often at perimenopause, we don't always ovulate at every period that we have, and therefore we don't have the hormone progesterone that is released with ovulation. And so even with the small quantities of estrogen on board, we are in an estrogenic state. The estrogen is not opposed by the progesterone, and that can increase the size of some of the glands, or if there are cysts or anything, the estrogenic state. But at the same time, because the entire breast tissue is less dense, you can feel these bumps better. So they may have been there in the past, but you actually are more aware of them. Now, many women notice that their breasts do feel different in perimenopause. Sometimes they're tender, sometimes they're lumpy, and later on the shape and the size also changes. They're all expected changes, and I think the most important thing is being aware of what is normal for you and what is a new change that you've noticed. So some of the common breast concerns are cysts, benign cysts or fibroadenomas. They're also called breast mouse because it just sort of runs away as you try to examine it. But cysts and benign lumps are the very common changes in the aging group. And breast pain is rarely cancer. So if you just have a isolated symptom of breast pain, whether it is, especially if it's bilateral in both breasts, it is very uncommon for it to be as a result of cancer. In fact, that is sort of a reassuring symptom, especially if it's bilateral and it sort of comes and goes near the cycles. Nipple discharge, whether that's something that is visible when you look at your breast or you can express it, that needs to be checked, especially if it's a bloody nipple discharge. So cysts and fibroadenomas, cysts are, I mean, they can feel quite hard, but they can also be like squashy. Fibroadenomas are more, they can be quite firm and they can run away from the examining, under the examining fingers. But these are, they're benign changes of the breast are relatively common. But we want to know when we should be seeking medical advice. And these, what you see on the slide is the sort of red flags. So if you notice any of these, a new lump that wasn't there before, or dimpling in the skin of the breast. So they describe a sort of an orange peel look, so puckering or dimpling of the skin, because that is a sign that something from inside is pulling the skin inwards. Or any redness, nipple changes, or inversion of the nipple. Some people have just naturally inverted nipples. That's absolutely fine. That's why it's really good to be breast aware to know what is normal for you. But if it's a recent or a new change of nipple inversion, or there's discharge that wasn't there, these are all sort of red flags that you need to get checked. And then if you have a persistent one-sided pain, again, that doesn't equate to breast cancer, but it just means that you need to get yourself checked out earlier. So if you notice any of these things, you need to see your GP. Again, as I don't want to increase or create any anxiety. It doesn't mean that you have cancer, but it's always good to get checked and not to assume, just not to leave it, because there's so many treatment options right now available. It's really important to be breast aware and to self-examine, because I think, what if we get used to examining our own breasts, we know what is normal for. So even inversion of nipple to a new, if you're seeing a healthcare professional new and they haven't examined you before, they may think that this is, completely abnormal. But if you've had it for, 10, 20 years, then you can reassure them that actually this has always been there and it's like that. And so the diagram on the right is going through the stages of examination of breasts, but the important thing is just to stand in front of the mirror and look for any changes in nipple change, any abnormal discharge. Look at the skin, the texture. Is there any dimpling, any puckering? Are there any sort of lumps or bumps or skin changes that you can actually visibly see before you've even begun to examine yourself? So looking is one of the best forms of examination when it comes to breast. Then, of course, touching, and you don't dig in with your nails or tips of your finger. You can use the pads of your fingertips. You start from the top of the breast and move in a circular motion or semicircles. And initially when you start examining yourself, if you've never done it before, it may be very strange, as in you wouldn't, you might think, well, I don't know whether, because it's not completely smooth. A lot of people have little bumps and lumps there. So it may be sort of weird that, I don't know, or you may actually get anxious. Is this new? Of course, you can always go and get examined by a professional, but with time, you will get used to it. You will get used to whether or not this lump was there or not. Or and it's also really important, as well as the breast, to check the armpit area. That should be part of the breast examination. So you don't stop just with the at the contour of the breast, but you need to move your fingers up on the armpit and feel for any lumps there. And of course, then you can bring that to the attention of your GP or any healthcare professional that you're seeing very early on. And if you're unsure, you can ask your GP or nurse to go through this examination with you, because it's really important to be aware of how to do this. So looking after your breast is about building habits. Building habits to, the recommendation is that monthly or bi-monthly you should self and attending the screening programs for breasts, that's mammograms that is offered in NHS. Mainly, it starts at, in the majority of areas, it starts at 50, because every 3 years, that's the sort of normal, regular breast screening test. And it sort of stops at 72 at the age of 7, but you can opt to stay in. So you can just, discuss that with the care center that is giving you the screening and opt to stay in. But attending the thing with the mammograms, and I often get asked that, can it spread the breast cancer that may be there if I have a small breast cancer? People get anxious about having this investigation, because as anyone who's had a mammogram knows that, yours are quite flat, they get squashed and flattened, and people get anxious about the spread of these if it's there. But breast cancer doesn't spread with actual physically squeezing it doesn't, it can't do that. And nowadays the mammogram machines are have much less radiation. It's pretty safe, especially if you're doing it at an interval of every few years. Wearing supportive bra is, for people especially that have larger breasts or they have painful breasts, is quite comforting. And just being aware and taking yourself for examination if you feel, even if you're in between. As I said, the screening, the NHS screening is every 3 years, but of course you shouldn't. You should be examining yourself between this time and bring any changes to the awareness of your health professional. Now, lifestyle makes a huge difference when it comes to reducing the risk of breast cancer. They're almost the same sort of habits that reduce the risk for heart disease, for osteoporosis, and for just the cancer in general. So and I will go into a bit more detail of this when I talk about HRT and risk of breast cancer, because that's something that makes people quite anxious when they're coming to choose to begin HRT. They often ask about the risk of breast cancer. So it's important to be aware of how you can reduce your own risk, or what is actually most risk that you're taking. So staying active, exercising on regular basis, limiting your alcohol intake, and again I'll go into details of that when we talk about HRT and breast cancer. And smoking if you're a smoker, and not starting if you're not, that they make a huge difference to the overall risk of cancer, including breast cancer. And of course, managing our cortisol level by trying to sleep well, and to troubleshooting if there's long-term chronic problems with sleep, which we know can affect the stress hormone or cortisol. Most breast cancers are not inherited. So lifestyle factors, especially alcohol and weight, play a huge role in management of this. And these are the same habits, as I said, that reduce the risk of other diseases. So it's really important to, it's a good time almost like a good time to press the reset button. Look at the lifestyle in general. Try to reduce the risk of chronic diseases like diabetes, like osteoporosis, cancer in general, and just be more aware. So when you make those very sort of targeted lifestyle changes, you're not only reducing the risk of breast cancer, but reducing the overall risk of chronic disease in the following decades. Now, HRT and breast cancer, as we all know, is one of the biggest concerns for women who've had a hysterectomy. They often are given HRT as estrogen only HRT. I don't often do that, as you know, some of you here that are my patients, you may know, even in a lady who's had a hysterectomy, I usually put them on a bit of progesterone as well, because natural progesterone has other benefits other than protecting the lining of the womb. But let me actually go to the next slide, because, and then if we need to come to this, we will, but because that really digs into the various, and you may have seen this in other talks, but this sort of explains the risk of breast cancer when it comes to, it compares various different lifestyle options with HRT. So if we look at, you know, the blue figures here are the overall background population risk of breast cancer in the UK. So there's 23 cases of breast cancer diagnosed in the general population per 1,000 women between the ages of 50 to 60. And the purple figures are the extra risk, so the increased risk, and the light green are the reduction in risk. And so if we just look at the reduced risk, this says 4 fewer cases in women on estrogen-only hormone replacement therapy. So this is the woman who's had a hysterectomy, who's only on estrogen, and they're saying that actually that causes a reduction in breast cancer risk. Now, they looked at biologically identical or body identical estrogen when they were looking at this study, whereas when the progesterone in it, which is in the combined hormone, unfortunately was only the artificial progestin. So and that's why this result is, so we have to put it in the context and disclose that as well when we look at. So often, you know, with many of you who are patients at OMC, you're probably on a biologically identical estrogen and progesterone, so it doesn't come under this, but this is an artificial progestin, and they're saying that this increases the risk of breast cancer by 4 in women, whereas estrogen only, which was biologically identical, reduces it. Now, if I just bring your attention to the bottom of this chart, you'll see that having a high BMI and body mass index, so you calculate it by dividing your weight in kilogram by your height in meters squared. And if that figure is equal or greater than 30, you're over doubling your risk of breast cancer. So by far the highest risk is being obese or significantly overweight. Then is if you are drinking 2 or more units of alcohol per day. So persistent sort of everyday drinking 2 or more. So you know, if you are drinking alcohol, is actually, when it comes to risk, of course, it's the quantity as well, but it's being alcohol free for some time in the weeks or days in the week or weeks in the month. Is that persistent being exposed to it? And being a current smoker. So if you are drinking alcohol every day, you're a current smoker, your BMI is 30 or greater, your risk of developing any cancer, including breast cancer, is by far more than if you were started on HRT. And contraceptive pill, which is a higher dose artificial estrogen and progesterone, that increases. It has the same sort of risk to it, to the artificial progesterone only. And this is the greatest reduction is by taking regular moderate exercise per week. So that's about 2.5 hours of exercise on a weekly basis. I hope that sort of gives you some clarity and reduces your anxiety about when it comes to your choice of a treatment at perimenopause and menopause. But of course, if you have any questions about this, we can always come back to it, or if you want to raise anything right now, please do so. Again, that's another thing that we know during a consultation and throughout the years that I've been seeing menopausal women, I get asked quite a lot about supplements and herbal remedies. And some women do feel they get relief from certain supplements and herbal remedies, especially vitamin E or evening primrose oil. These can offer help with breast tenderness or cyclical pain. The evidence, there is some evidence, soft evidence, but it's not very strong, that evidence. But, evening oil of primrose, if it's taken consistently, in a lot of women, it offers some support for breast tenderness. Omega-3 can support inflammation and overall health. Phytoestrogens, they're just basically estrogens found in food and natural herbal remedies. They're found in soy, red clover. They have a weak estrogen-like effect. There's a bit of a mixed mixed results from research when it comes to phytoestrogen. But it's really important to remember that these remedies shouldn't delay your getting help or getting investigations or examinations. So you shouldn't be self-medicating, even with, just think, oh, this is just a supplement or herbal remedy. The important thing is to make sure that you get the right screening, the right investigation in a timely manner, just so that, if there's anything sinister, it can come to light much quicker and things can be done about it. Now, for women who've had a history of breast cancer or any sort of hormone positive gynecological cancers, they shouldn't be started on supplements and herbal remedies which may have a weak estrogenic effect. So you really need to be under care of a specialist. Always check with your doctor before using any supplement, especially if you have a past history or currently under treatment for hormone receptor positive cancer. So just remember that changes are expected, like the changes that happen. Breast tissue often doesn't stay sort of stable. It can feel different even before perimenopause. The feel and the texture of breast changes throughout the month. But when it comes to perimenopause, due to the high fluctuations of hormones, estrogen and progesterone, the fact that you may be in an estrogenic effect, even with a formal low estrogen level, that sort of creates more evident changes. And the fact that breast dense, more fatty, so therefore easier to feel these cysts and lumps. That's quite common for that to happen. And but most symptoms are benign. Lifestyle really does help, and HRT can be a safe thing to take, and it can be absolutely, even in the presence of previous breast cancer, in some circumstances, it's still okay to take it. But of course, it needs to be under care of a specialist and with the right guidance. I've left a couple of websites here that have really good it can give you better guidance and support. Of course, you can see your GP. There's some resources under our website as well that you can take. And yeah, so I'd love to hear about your questions. If you don't want me to go back on any particular slides, I can stop sharing now. And I know Agni told me that there's been some good questions that have been